Hey! Okay, so today I just want to talk about the differences between the Australian and British healthcare systems. There are quite a lot of differences, and when I first moved to Australia I didn't actually realise how big the difference is, and also how Medicare in Australia works when you have a reciprocal healthcare card rather than the full healthcare card that Australians and permanent residents have. Okay, so the main difference is that obviously in the UK you have the NHS, and unless you have private healthcare through work or you choose to pay for it, or you have like Bupa or any other kind of private healthcare that you pay for yourself, most people use the NHS, and the NHS covers you for absolutely everything. Literally everything is free, from your doctor's appointments to your prescriptions to any specialist appointments, any surgeries, anything like that. The only things that you do have to pay for is any dental care, and with prescriptions, even though some are free, there are also, like, most prescriptions you do pay for, but it's capped. So it's capped at around £8 at the moment, whereas in Australia there is no cap. But I'll talk about that a little bit later on. But yeah, that's the main UK difference, is that we have the NHS and it's incredible. So with doctor's appointments, in the UK these are all free. It does usually take about 2 weeks to get an appointment, because the doctors in the UK tend to get booked up very far in advance. When I'm in the UK, every time I try and get a doctor's appointment, it literally takes me 2 weeks to get one. And obviously when you're sick, that is not what you want, because most of the time when you're sick you want to see the doctor when you're sick, not 2 weeks later when you could either be dead or much worse or better, and then you're like, well, what was wrong with me? And then you have to like suffer through those 2 weeks being ill. Whereas in Australia, it's very easy to get a doctor's appointment within a couple of days. So quite often you'll be able to get a doctor's appointment the next day or on the same day. These aren't always with your normal doctor. You might have to see another doctor in the practice, but the doctor that I go to, which is a popular one because it's in the city, they always have at least a couple of appointments available every day, and you can book online as well. So you just book online, that gives you all the appointments, and there's usually a few each day. But even with my normal doctor, who tends to be the one that gets booked up, I can still go and see her like maybe 3 or 4 days in advance, and it's completely fine. I don't have to wait, basically I never have to wait 2 weeks to see a doctor here, which is amazing. However, if you have a reciprocal healthcare card in Australia, you quite often have to pay a gap fee for a doctor's appointment. So if it's a doctor's that bulk bills, which basically with Australian Medicare, there's the private side to Medicare and the free public side to it, and it's very confusing. I'm still confused, so please do not take my word as gospel, because I'm probably somehow a little bit wrong, because it's very complicated and it's like a really complicated system. But there's bulk billing and then there's private, and if a doctor's surgery bulk bills, that means that you do not have to pay for your appointment. But if you have a reciprocal healthcare card, which is what anybody who is on, basically anyone who from the UK who is in Australia and not on a permanent residence visa or who has citizenship, you will be on a reciprocal. Even if you're on a 457 for 4 years, you will still have a reciprocal healthcare card for 4 years, for the full time that you're here, basically. So that means that certain doctors, even though they bulk bill, they might charge you an extra fee because you have a reciprocal card. So the doctor that I go to, it's $15 between the hours of 10 AM and 4 PM. Outside of those hours and on weekends, it's $35 to go and see the doctor. Sometimes if a doctor doesn't bulk bill, you can still go to that doctor and pay the full fee, which is usually about $70 to $80. And then they'll give you a form to fill in, and then you can fill it in, and sometimes you'll be able to get some of that money back. But it's a total pain in the arse to fill in those forms and take them to a Medicare centre. mainly because the Medicare centres are only open during like work hours, so between 9 and 5, and obviously you're at work then, so it makes it really difficult. And even if you try go on at lunchtime, quite often the Medicare centre is nowhere near my office, so if I want to go to the Medicare centre I have to take an extra hour out of work around my lunch hour to go and do it, and also because there's usually a massive queue, so yeah, just be prepared, it usually takes quite a while. And you can do it online and they've got an app as well, so you can do it via the app. But every single time I've tried to do it online or via the app, it's given me an error message. So I'm not sure if it works for other people or how it works for other people. But yeah, that's just something to be aware of. Now, this is more for women than men, but when it comes to birth control, so in the UK, all birth control is free. So whether you're on the pill or any other methods, it's free. You don't pay for anything. In Australia, it can be very expensive. So for example, with the pill Yasmin, which is a very popular birth control pill, in the UK, it's free. All of it's free, completely free for your whole life. In Australia, it's $80 for 3 months worth. So as you can imagine, over the course of a year, 5 years, 10 years, whatever, it costs a lot of money. A lot. So I actually went back to the UK, and when I went back I got a whole load to bring back with me, but in the UK they would only give like a maximum of 6 months worth or something, so then I had to buy more in Australia, and it cost me $80 for 3 months. It was painful. Knowing that it's free back home, it was so painful having to pay that much money for 3 months worth just so you can like control your periods or not get pregnant or any of those things. So yeah. Now, when it comes to seeing a specialist for something, in the UK you typically get referred by the doctor to a specialist at an NHS hospital, and then it takes months, sometimes weeks, usually months, to then get an appointment for that specialist, and then when you do get that appointment months later, it's usually months away. So it usually takes a long time, unless it's something very serious and urgent, then you'll be seen immediately. So a few years ago, my mum was diagnosed with melanoma, and she had a same-day appointment up at the hospital. As soon as the doctor confirmed what he thought, as soon as he was like, no, I'm sure this is melanoma, he sent her straight to the hospital, called ahead and got her into an appointment with a specialist at the hospital, at the NHS hospital, on the same day, and then they did scans and MRIs and stuff and confirmed that it was melanoma. If it's not something as urgent as that, or something that the doctors don't think is urgent, then you will wait months and months and months. In Australia though, you don't really wait very long at all, but it's a very strange system and I still don't understand it at all. So I go to a public Medicare bulk billing doctor's surgery, so you would think that they would then refer you to a bulk billing specialist in a public hospital, but every time I've been referred to specialists, they've been private ones, and they've cost me anything between $200 for 15 minutes to $400 for 15 minutes, and the $400 one you can, no, I could claim $100 back from that, from Medicare, so I had to do that form thing, so I got $100 back, so it only cost me $300, but still, $300 is a lot of money for 15 minutes of someone's time, and it was literally a checkup because last year back in the UK, I had surgery on my throat to remove my lingual tonsils, and your lingual tonsils aren't your normal tonsils, they're like here in your throat, and they're supposed to be flat, but mine was so large that they completely blocked my throat and I couldn't really breathe or eat or swallow. And yeah, they had to do 2 operations to remove them, and they removed them, and they were literally like 2 cup, so you know those like little white medical cup things they have in hospitals? There were 2 of those completely filled with lingual tonsil tissue when they're literally supposed to be tiny little flat nodule things. Anyway, so I had to have a checkup appointment in Australia to make sure that they were all okay and hadn't grown back. 15 minutes, $300 later. Yeah, I was not impressed. It cost so much money for this guy to literally just look down my throat and say, yeah, you're fine. That was it. He literally put like some little camera thing down my throat and was like, oh yeah, they look completely fine to me. And then I walked out. And that was it. $300. Insane. Similar to specialists with scans, it's also very, very quick to get an appointment for a scan. So whereas in the UK, they're usually very reluctant to refer you for any kind of scan. For about 10 years now, I've always had pains down kind of in my ovary uterus area, and it's like a sharp pain that every so often will just like give me this sharp pain. And so I started going to the doctor about that about nine years ago. I'd had it for maybe a year, so 9 years ago, and it was only this year when I moved to Australia that they actually found out the cause of that. And that was because for 8 years in the UK, they refused, well, yeah, they pretty much refused to do any kind of scans, to just investigate it at all the whole time. Every single time I went and was like, I'm still having these pains, I'm still having these pains. They made me feel stupid. They made me feel like I was imagining it, and they pretty much ignored me. In Australia, I went to one doctor's appointment and was like, look, I've had these pains for about 9 years now. My doctor in the UK completely ignored them and told me that I was imagining it. Is there anything that you can do? And straight away she was like, yeah, you need to have an ultrasound done. We'll get one set up for you. 3 days later, I had an ultrasound. 3 days. It was crazy. Like, what? And it was free. All scans in Australia are free, and well, it depends where you go. There's one place that I went to and they were like, oh, we have to call up Medicare and check that we can bulk bill you because of my reciprocal healthcare card. And then they called them up and I was like, yeah, that's fine. And then I went to another place a couple of months later and they, as standard, bulk bill everybody. So, I mean, I was just shocked that you can just get a scan within 3 days and it's free. I mean, in the UK that would never happen unless they thought you were dying. But yeah, so I had the scan and they straight away were like, yeah, this is the reason you've had all these pains all these years. This is what's wrong. And then they were like, we'll see how it goes, we'll monitor it, and then we can either do some surgery or just leave it depending on how it goes. So yeah, so that's one thing that I've been very impressed with in Australia, is the speed in which things are done. Things are done a lot quicker here, even though it was all free. I was expecting to have to pay. When I was on the phone to the scanning clinic place thingy, whatever it's called, it's like part of the hospital, she was like, oh, we can fit you in 3 days time. And my first question was, oh, so do I have to pay for that? Is it private if it's in 3 days time? She was like, no, it's just, that's the next appointment we have. I was like, okay. I was like, do you regularly have appointments this close to when I'm calling? She was like, yeah, as if it was the most normal thing. And obviously coming from the UK where I spent 9 years not even being able to get a scan done, or anything you have done there you have to wait months for, it was just blew my mind, and it was great. I was very happy with that one. When it comes to surgeries, unfortunately it's not as good as the whole scanning thing. So with the surgery, I'm one of these people that has a lot of health issues, and it's always around the same area. So in my throat, I've always had issues with my throat ever since I was a small child. I've had multiple surgeries on my throat for adenoids, both tonsils. With my adenoids, I've actually had my adenoids removed 4 times. They're supposed to stop growing or shrink or whatever when you're 9, but I had my last adenoid removal when I was 18. Just that area is just always, oh, the lighting just went shadowy and I'm not sure why, sorry, okay. But this area just always has issues. And so after all of those throat surgeries, I then started getting really bad heartburn, and I still have a sore throat and a cough, like quite a dry cough. So when I had my specialist checkup earlier this year in Australia, I mentioned all of this and that I was worried that maybe they were growing back because I had the same sore throat. And he was like, they're definitely not growing back, but I'm going to refer you to a gastro specialist to see if it's some sort of like acid reflux thing, or whether, because apparently the same tissue that is like your adenoids and tonsils or whatever, apparently it goes all the way down into your stomach. So they weren't sure if I had another issue with that kind of tissue but further down in my stomach. So he referred me to this gastro specialist, and then after ruling out that it was acid reflux, he then wanted to do I can't remember the name, it's like an they put a camera down your throat into your stomach basically, and then look inside your stomach to see, like, I guess whether any of the tissue down there, whether there's like an issue with it and it's causing something up in my throat. I have no idea. Anyway, that surgery was going to cost me about $2,000, so I did not have that done. Yeah, so I'm gonna wait until I get back to the UK and then go back to my doctor and say, my doctor in Australia said that I need this because of this, blah, blah, blah. Can you please refer me to a specialist? Hopefully they will actually refer me to a specialist, but who knows, because I was ignored for 9 years on the other issues, so maybe they'll also try and tell me that I'm imagining this one too. But we shall see. And also, lastly, I just want to quickly chat about the reciprocal card thing. So it's very confusing because Australians who go to the UK get all of their healthcare for free. Everything is covered. If you move from the UK to Australia, a large amount of it is covered, but there are certain rules and certain things that aren't. So for example, with my surgery for my camera throat thingy stomach thing, if I had a full Medicare card, that would be free. It's because I'm on a reciprocal card that I would have to pay $2,000 for that surgery. I'm not sure why. I have no idea. Even the specialist couldn't explain it. He doesn't understand it. He just said that that's what they've been told by Medicare. Yeah, I don't understand it. But obviously the thing is, if you're living here for 4 years, that is a long time to go without free healthcare and with having to pay for most things, because even if you go to a doctor, some of them bulk bill, but some don't, and some charge you a gap fee because you have this different card. Yeah, it kind of sucks. Well, a lot of people tend to actually buy private health insurance in Australia, but I've chosen not to, even though I have all these issues. I've chosen not to, not just because I'm cheap, but because when I looked at it, loads of them had these really confusing clauses and exceptions, and I was just like, I feel like I'm going to be this exception. Like, everything they list that they do not cover, that will be me. So that's why I didn't do it, and also because I'm probably not going to be here for 4 years. I'm probably only going to be here for like 2 years maybe. So I just figured obviously things like my throat and stuff, as far as I'm aware, I hope, touch wood, that it's not life-threatening. It's not something that I'm going to die from, hopefully. That's something that is probably, hopefully, just one of those things that's annoying. So I can wait until I get back to the UK to have that surgery done, or it's not even surgery, it's a procedure to look inside and see what's wrong. It's not even the surgery part to fix it, which is why I didn't want to pay $2,000 just for them to look inside and see if there is an issue. Because then what if you paid $2,000 and then they're like, oh, we couldn't see anything? What a waste. But if it was something that was life-threatening and I really needed something done that was urgent, I would obviously pay it and just be like, okay, it's worth it. But because this is something that the doctors don't think is, I'm not going to pay $2,000 for them to look inside me and be like, no, we couldn't actually find anything.